Senator, thank you for being here.
Veronica, it's such a privilege. Thanks so much.
I'm excited to meet you and to talk about this very important topic, which is healthcare affordability. We keep hearing in Minnesota we have this affordability crisis, and obviously healthcare plays a role in that. You're a doctor, so you see this firsthand. What are you hearing and seeing?
I'm hearing it from my patients every single day, and it's at every level and every demographic in Minnesota. So if you're a person on Medicare, often you can't afford your Medicare Advantage plan in this day and age, and it doesn't give you very good coverage. If you're an independent purchaser of the healthcare market, like a farmer or a small business owner, we've seen the termination of advanced premium tax credits at the federal level, so those prices are going up by 40%. And then there's going to come this coming year a $1 trillion cut in medical assistance, which is going to affect every hospital, every clinic in the state of Minnesota, from my old alma mater, downtown Minneapolis, Hennepin County Medical Center, to rural hospitals in Alexandria and Northfield. And so we need to address the affordability crisis. We need to do it comprehensively and across the board and make sure Minnesotans have access to health care.
That sounds scary and adds a lot of urgency to this. To that end, you've introduced several pieces of legislation this session to address affordability, one of them being Senate File 3769, which is bipartisan. It's the 340B drug pricing program. I'd never heard of it before, so tell me about it.
Well, usually when you start talking about 340B, people's eyes glaze over because it sounds very bookish, but I'll tell you what it is. It's a federal program, and it's a good one that said pharmaceutical companies need to provide our safety net hospitals with low-cost medications so that individuals in Minnesota have access to affordable meds. A few years ago, Big Pharma just started ignoring the federal law, and they weren't providing these low-cost medications to our Hennepin County Medical Center, to North Memorial, to Essentia hospitals, and hospitals as a result were losing a lot of money, and it was threatening their bottom line. We passed a bill a couple years ago that said you've got to obey the federal law, but Big Pharma continued to ignore it. So this year we had a bill that gave the Attorney General power to enforce that law, and in other states where they've done that, Big Pharma has finally toed the line.
Talk to me about that. You know, you've said it holds Big Pharma accountable. What would the Attorney General do?
You know, I think what we've seen in other states is just knowing that the Attorney General has power to prosecute and bring cases has forced Big Pharma to obey the law. So it's just the threat, honestly, of his capacity to hold them to civil litigation that enforces compliance.
That makes me chuckle. It makes me think of a parent like, if you do this, and then they're like, okay, I won't. Talk to me about how this could improve affordability. Would it trickle down to patients?
It really does. You know, if you're a patient, again, that's going to a safety net hospital and you get discharged on a blood pressure medication, that medication is going to be more accessible and more affordable and at many pharmacies for you than it would be if pharma continues to ignore 340B. So we know that drug prices are a big affordability crisis in and of themselves. Here in Minnesota, a couple years ago, we passed a prescription drug affordability board that'll give the state of Minnesota power to regulate drug prices if they go up excessively. I continue to believe at the federal level we should be negotiating drug prices on all drugs covered by Medicare, and we should regulate drug prices a little more aggressively. Healthcare in America is in crisis almost at every stage of the delivery system: hospitals, clinics, physicians, insurance. But the one area that's doing very well in the healthcare delivery market is Big Pharma. They're doing very well. And so we need to sort of spread the wealth a little bit and make sure that our patients have access to good medications.
You've talked about how this is for our rural pharmacies and our safety net facilities. We know that Hennepin County Medical Center is having some financial strain. Could this be part of a longer-term solution to that problem HCMC is facing?
Well, you know that I practiced for about 15 years. I worked nights at Hennepin County Medical Center. It was a passion project. I loved it very much. I was always inspired to walk through those doors. It is a Minnesota institution, a gem. We train good doctors there. We give good care, and I think it's one of the best aspects of who we are as Minnesotans. I'm intent this session, in my final session here at the legislature, on saving HCMC, and yes, 340B is an essential part of that. They cannot lose those dollars. But we do need a bigger solution, and we're going to work on some statewide resources to direct to not just Hennepin County Medical Center, but to sustain all our hospitals, our rural hospitals that are struggling, and North Memorial and Essentia. And so I think Minnesotans know that sustaining our hospitals is essential to who we are and caring for each other well, and we're going to try to get that done in the final 4 weeks here.
So your bill on the 340B drug pricing program passed with a 42-24 vote, which we love because that shows some bipartisan buy-in. It was The idea was welcomed by both caucuses, but it was debated on the floor for nearly 2 hours. If there was a main concern that was brought up during that debate, what was it?
Well, it was not only passed in a bipartisan way, but it had bipartisan authorship, so I was proud of that. It passed bipartisanly in the House as well. I think what you saw in the lead up to that vote was that Big Pharma was spending upwards of $1 million a day on television advertising. They were really opposed to this law. And you know, they have a powerful lobbying capacity, and I'm really impressed that we were able to muster the 42 votes. I think the 2-hour debate was a reflection of the fact that they had spent a lot of time and energy lobbying individual legislators to try to shut this program down. But at the end of the day, Minnesota legislators know what's good for Minnesotans, and they were able to pass this in a bipartisan way.
Do you think there's still room to improve this program on a state level?
You know, it's a good program. I think it's worked for 30 years the way it should be, and I think we should keep it going and make sure that it's enforced appropriately.
You mentioned that it passed in the House as well. So if it goes into law, assuming the governor, goes forward with it as well, how soon could it start having an impact?
Well, you know, it could start having an impact immediately because, if they're currently not fulfilling their obligations under federal law to sustain 340B payments, and then they start to do so, I think hospitals like Hennepin County Medical Center will notice the difference on day one. So I'm hopeful the governor can get this signed in the next couple of weeks here.
That's great. We need that now. You've also authored Senate File 3859, which would create a vaccine advisory council here in Minnesota. Why do we need that?
So there used to be a very legitimate and austere vaccine advisory council at the federal level, and it was gutted. All 17 of its members were fired by RFK Jr., and he replaced them with conspiracy theorists and his cronies. And their advice is not based in science and is not reputable. We need to recreate that. We have good medical resources here in Minnesota with the University of Minnesota and with Mayo Clinic, and I thought it would be wise if we got together those resources and those voices to give Minnesotans the best possible advice on what good science-based vaccine practices are. At the end of the day, it's an individual's decision what vaccine they want to take or what they want to have their kid take, but we thought they should have at least access to reliable information based in science on what the best advice is, and we're going to try to set that up in Minnesota.
I remember hearing when this bill was being debated that it's not requiring anyone to have vaccines. It's just giving them access to information and recommendations, because I know that was a fear, right? People don't like being required to do things. But on that note, Minnesota is the fourth worst state in the country when it comes to childhood vaccinations. So how did we get here?
Well, you remember the candidacy of Dr. Scott Jensen just a couple years ago, who ran for governor and really ran on an anti-vaccine type of agenda and spread misinformation during that time about the COVID vaccine and mRNA vaccines in general, which are some of the greatest scientific advancements in health in the last couple of decades. And so I think he really poisoned the waters for us a little bit. RFK Jr. obviously fed right into that same narrative. We need people who are educated in science to sort of stand up against misinformation, use their voices, use their platforms to make sure Minnesotans have access to the best possible advice. The other interesting thing about the vaccine bill is not only does it sort of give good science-based recommendations on vaccine policy, but it also requires that insurance companies cover those recommended vaccines.
Right, and that's how it ties back into affordability, which is what we're all looking for. You said that this could help clear up misinformation around vaccines, but how do we do that? How do we reach and connect with the people that have those questions or concerns?
It's tougher in today's environment. We have so many media sources, and people tend to polarize towards the media sources that affirm their preconceived biases. And we're all guilty of that. But I think just simply setting up something that truly is nonpartisan, non-political, based in what the best medical evidence has to give us, is at least putting it out there for Minnesotans to seek out if they so choose. That's, I think, the best we can do in this moment, is to offer the truth, have it available to people, and if they choose to follow a different pathway, that is certainly their prerogative, but at least they'll have access to it.
I want to turn now to a bill that isn't yours, but you've supported it. It's Senate File 3650, which is a bipartisan bill authored by Senator Draheim, which would ban direct-to-consumer advertising of prescription drugs. Now, aside from seeing so many commercials for that, where's the harm?
It's interesting. I hear a lot of anger about this from Minnesotans when I meet with them in town halls and so forth, because people go to the pharmacy and they can barely afford to fill their prescriptions, say, for rheumatoid arthritis or for high blood pressure. And yet they sit and watch television in the evening and they see these hugely expensive produced medication ads, and they see that a lot of the money they're spending to try to take care of their health is going to produce these fancy commercials. So that's the first part about it. It is raising the costs of pharmaceuticals and it's not helping patients. And the second part about it is direct-to-consumer advertising sort of bypasses the physician, bypasses that gatekeeper for what good advice is medically, and sort of could influence patients to pursue bad medical treatment.
And how could that tie into affordability?
I definitely think if we could regulate and limit the amount, so medical companies, pharmaceutical companies are supposed to be using their money on research and development, developing new medications, bringing them to market, improving them once they're out there. To the extent that they are spending a large portion of their budgets promoting those products on television, on the internet, that's raising costs for Minnesotans without any real benefit to Minnesotans.
All right. Well, Senator, this has been a great conversation. Thank you for your time.
I'm so honored, and thanks for having me on again.
Absolutely.